I will now introduce Kathleen Picard, one of our APTA Minnesota State Government Affairs co-chairs, to discuss our Practice Act revision. Thanks for joining, Kathleen.
Thank you. It's great to be here.
I am going to ask you some questions about our Practice Act revision for our members. Why is this Practice Act revision important?
This Practice Act is super important because it's an opportunity to update the law that governs practice of physical therapy in the state of Minnesota. It benefits not only our patients, but it benefits us in that we're able to practice at the top of our license and as a way other practicing PTs and PTAs do in other states.
Thank you. Now, can you briefly describe the changes that we are making?
Yeah, this is a massive change in our Practice Act. And so there are four major areas of changes. The first and most important is to remove the access barriers to physical therapists. Those barriers have been in place for a very long time, and they include removing that referral requirement after 90 days of treatment, even if the patient is getting better and benefiting from our services. So we remove that 90 days. We're trying to remove the 1-year limitation on independent practice without referral for individuals that have just been newly licensed and are within the first year of their practice. And last, we're removing language that insinuates physician oversight. And a good example of that is the duty to consult with a referring physician if we choose to change the care plan that they're suggesting. So that's one big area. A second area is that we're trying to update the statute to reflect contemporary training and contemporary practice of doctors of physical therapy. And that would include affirming that diagnosis is part of our scope of practice and affirming that health promotion and maintenance of fitness, wellness of populations of all ages is also within the practice of physical therapy. A third section is very important for physical therapist assistants and PTs alike. We're trying to update the language to reflect contemporary training of licensed physical therapist assistants and the collaborative and team approach that we now practice both in patient care and in supervision of the students. The last section of change is also significant, and it creates greater protection of the term physical therapy, and it allows for title protection for the term doctor of physical therapy, and of course that acronym that's so controversial here in the state of Minnesota, DPT. So those term and title protections also will then allow our licensing board to impose civil penalties on anyone who violates those protections. So that's the big picture of the changes that we're making.
Great. Thank you, Kathleen. Haven't we been working on this forever?
Yes, I have personally for 42 years. So we started really trying to change our Practice Act for direct access in 1980. And what we were successful in doing at that time was just getting an evaluation. That was it. We could evaluate a patient. We were allowed to diagnose a patient, but we could only consult. We couldn't treat. We couldn't provide interventions. So 5 years later, in 1985, we were successful at getting interventions, but we had to give something up to get that. We were limited to 30 days of treatment before the patient would have to go back and get a referral. And that's the year, in 1985, when as a result of a compromise, we ended up with physical therapists in their first year of licensure not being allowed to practice independently without referral. And then there was a long time when we were actually working on our Practice Act, but not about access, other things, licensure for PTAs and such. So we moved down the calendar to 2008. Okay, so that's still a long time ago, 23 years after we got direct access to evaluation. So in 2008, we tried to get rid of the 30 days, and another compromise was before us. So we ended up getting 90 days of treatment without needing a referral for something that's medically undiagnosed. And that's where we're at right now. So here we are in 2024, now 44 years later, trying to remove all of the rest of the barriers. I will mention that in 2008, the bill that was passed for 90 days also had a a term in it that required a report to the legislature by our licensing board of any instances of harm that might have happened in that year where we had direct access for 90 days. That report came back 100% clean. There was no evidence of harm or safety concerns by our board. And the intent was for us to come back in 2010 and just take care of the rest of it. But it's been an uphill battle. Some of the battle has been with other groups that we've just kind of diverted our attention to defending against some of the bills that they had. But here we are now back starting in a role about 2017. We've been starting to work on this Practice Act revision. We did have a hearing in 2020, but then COVID shut down the Capitol. And so we didn't get a hearing in 2022. And we're hoping now in the last year of this biennium to get the hearing in 2024. So a long time.
Thank you. Don't other states have full access?
Yeah, there are 21 states that have absolutely no restrictions to access to physical therapists. The rest of the states all have some kind of patchwork of limitations, much like ours. And the reason why it's just such a patchwork of things and different requirements is that they were all compromised. Every single state that tried to go for what everyone else is going for, full access without referral, were stymied by the requirement of having to compromise this way and that way. So we're on our way to halfway through the states, but not quite there yet. And we want to be one of them.
Thank you. What is the resistance and opposition to the bill?
The biggest resistance come from groups who claim that they're very worried about the safety of the patients. They're worried that somehow harm will be done to them, will miss serious conditions, even though they don't have any real evidence or any examples of that happening. They just have this belief or this concern. No evidence that bad things have happened. In fact, we have all kinds of evidence to the contrary, saying that not only is it safe, but it's a really good idea in terms of making efficiencies in the system and costing less for patients.
Thank you, Kathleen.
You're welcome.